folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical
Together
therapist.
we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
I like those clapping monkeys. Okay, today we're going to talk about stop vertigo / dizziness at home using the Brandt Daroff maneuver.
There you
Did
go.
I say it right?
You bet you did, Bob.
All right. So before we do this, this is generally for BPPV, benign paroxysmal
Positional
vertigo.
yeah.
Well, I'll let you get into that later, Brad. But right now, if you are new to our channel, please take a second to subscribe to us. We provide videos on stay healthy, fit, pain-free, and we upload every day. Also, you're going to want to join us on our social media platforms. We're really everywhere now. We're just started on Instagram, official Bob and Brad. Got some neat pics coming up. And also, you're going to want to join us on Facebook, Bob and Brad, because within, we'd say, 39 days or so, we think we're going to hit 1 million subscribers, and we're going to have a big giveaway then, a big blowout, big party.
Little celebration.
And we'll invite everybody, right?
Well, yeah.
We'll be at your house?
Oh, yeah. Don't say that, Bob.
Just remodel his kitchen.
Yeah.
So we can get you all in there. All right, let's talk about the Brandt Daroff maneuver, Brad.
Okay, first of all, if you've got dizziness, vertigo symptoms, there are a number of things that could be causing it.
Oh, it's infinite almost.
Right.
I mean, it could be medications, it could be diet, it could be, there's so many things that you have to have it ruled out by a doctor.
Meniere's disease. So get it checked out first. You should see a clinician. But this is one of the treatments that's oftentimes used if people do not tolerate some of the common procedures like the Epley maneuver or the liberatory maneuver, which clinicians are familiar with it and they use them on a regular basis. Also, if your symptoms of vertigo have been going on for a long time, they're not real serious, but they're just not going away. And this is something you can do at home. Clinicians will also give this as a home exercise program because it's not real complicated. The thing about it is, it typically, like the Epley maneuver, will oftentimes work on the first time and the symptoms are gone and it's done.
First or second time. I mean, you might do it a couple times in a row, but
the first visit.
The first visit usually, quite often it might be gone.
Right. I would say 80% of mine were the first visit.
Yep, I would say you're right.
So, anyways, this typically takes up to 2 weeks and doing it at least twice a day.
So why would people do this instead?
Because you can stay at home and do it. You don't have to go.
Also, because they maybe didn't tolerate the Epley maneuver.
Right.
Yeah.
Didn't I mention that before?
Yeah, you did. But I'm re-emphasizing
Good.
it.
Yeah.
Because people are going to wonder, why would I spend 2 weeks doing this when I could get rid of it in one treatment?
There you go.
Yes, you should get rid of it in one treatment, but sometimes the Epley maneuver, you're going to get sick doing it, or you just can't tolerate it. And it's more complicated.
Yeah, and that's why, again, get this information from a clinician, and this is a good review to see how it's done.
Yeah, if you're going home with this assignment, this will be a good review for you.
Right. Okay, here we go, Bob.
Right.
Should I show them? Because they've been waiting. People have been patiently waiting, and we're going to show them the maneuver, and this is how it's going to go.
The Brandt Daroff.
The Brandt Daroff. Okay, so you need to find, a bed typically. You sit down so you can go both ways. Typically, you're going to go one direction, the direction that causes the dizziness.
So if your dizziness, in your case, would be that you kind of turn your head to the right and it comes on?
Right.
So you're going to go to the right?
No, I'm going to go the other way on this one.
You are?
Right. I'm going to go this. I'm going to look to the left.
So left is the one that causes it? Which one causes it?
It's the right-sided involvement, Bob.
Okay.
So
all right.
the right side's involved, and this is what you're going to get from the therapist to make sure you're clear on this. So if I'm going to go to the right, I'm going to look to the left, okay? And then you're going to quickly go down like this and continue to look up to the left.
Up to the ceiling.
Yep, and then you're going to hold that until the dizziness clears up, and then stay there for an additional 30 seconds. Now, I have to admit, Bob, I've taken 2 continuing ed courses on this, and I've read a bunch of information, and they all say a little bit different
They have little variations of it.
But that's good news, because that means you don't have to be exact on it.
Right, but you're doing the one that you just learned again, right? A continuing ed. This is the way they recommended it?
Right, exactly. I just did the test a week ago. And then after it clears up and you stay for another 30 seconds, then you go back up to here. and then you repeat that.
You said up to 5 times.
Right, 3 to 5 times in a row. Each time it must feel a little bit better.
Sure.
If it doesn't, if it feels the same or it's getting worse, it's not the right maneuver to do.
What if you do it the first time and there's no improvement whatsoever? Should you still continue? I mean, let's say you do it one time.
Right.
And there's just no improvement. Should you try it again?
Yeah, I would give it another try and see if there's if it gets better after you get up and get resituated, and then try it again.
Sometimes it's subtle.
Right.
I mean, the changes.
Each time you do it, it should feel like, oh, it's easier this time.
Yeah, you definitely don't want to make it worse.
Right.
If it's making it worse, you definitely don't want to do that then.
Precisely.
So, you want to show the other direction?
Sure. If you're going to the left, you're going to look to the right, down like this. Again, hold it till the dizziness goes away and the symptoms.
So it is really simple to do.
Right. Yep.
All right.
And coming up to here again. Again, you're going to do that 3 to 5 repetitions each time.
And you're going to keep going and do it twice a day.
Twice a day.
For up to 2 weeks.
Up to 2 weeks it could be before your symptoms are resolved.
All right, good.
So it's another way to do it.
I hadn't looked at that one for many years, so I'm glad that you reviewed this, Brad.
Yeah, me too.
So,
like I said, I've never did this with a patient because I've always had success with the Epley maneuver.
Right.
But again,
I've had patients though that I had trouble getting into the Epley maneuver position.
Yeah, right.
Because they're elderly. So, all right. Well, get rid of that dizziness. I know what a pain it is. I mean, it really is.
It is.
So, thanks for watching.